welcome to the Brain Development Podcast. We're here to show parents there is a pathway to healing the behavioural and learning symptoms of their very much neurodiverse child. And my purpose is to help empower parents to understand how they can build their child's brain from the bottom up to invoke change. And today we have a very special guest, Olivier de Wulf from Neurosonic. He's a highly specialised expert in bridging the fields of engineering and neuroscience and acoustic health. He currently serves as the president and CEO of Neurasonic, a startup focused on developing programs to assist with hearing, listening, and trauma integration. And with a background rooted in robust academic research, Olivier holds a PhD in bioengineering from the University of Liège in Belgium. And he also is trained as an audio psychophonologist. And I'm sure you're going to tell us a bit more about that and what that entails. But it demonstrates his commitment to influencing the nervous system through auditory and sensory inputs. And we know from our children that we need much more of this, and the sensory side of a lot of these children really needs to be worked on, and that boils down to the makeup of our nervous system. But his work at Neurosonic is dedicated to exploring how precise body-based therapies can restore the body's natural balance and optimize neurological function. Welcome.
Thank you, Lara. Thank you for the nice introduction.
Yeah, it's amazing. Tell me a bit more about how it works and what you do with your patients.
So basically, the ears and the brain has been evolving together to work and to bring ideal communication with the world around us. Unfortunately, sometimes that way of communicating with the world is not as ideal as it should. And we have noticed at Neurasonic that a lot of people have difficulties with that communication. So we have developed a way to retrain the ears so that the communication with the world is actually improving that way. To go a little bit deeper into the way it works, there are actually two components to the ear. There is a component that is called the vestibular system and a component that is called the cochlear system. The vestibular system is really specialized into the lower frequencies, which means that it allows the body actually to situate itself in the world, to get a feeling of the body image as well, and to basically feel different emotions in the body itself. The cochlear component is very different. It's sensitive more to the higher frequencies. And for that reason, it is the component that will work on communication itself, meaning the way you hear my voice, the way you push away a little bit the element around so that you can concentrate on that. And this is key. Unfortunately, in our world, we don't have a lot of ways to train this. And I feel a lot of people have lost the understanding that is so important. And I think that's why we see so many children now struggling with body image, struggling with communication, struggling with sound sensitivities, and so on.
And so, what are the profile of the people that you assist? Talk to me about that.
So this is a little bit evolved over the years. So originally we were working mostly with children with learning disabilities, and it can go from autistic children to dyslexia, dyscalculia, and so on. And we have seen that for most of them, there is definitely improvement in the communication part, but also in the part of the mathematics, of the behavior, the stimulation, and so on. But over time, we have also realized that it was actually helping way more people than just that. And we have now developed a program that are more targeting the vagus nerve. Vagus nerve is a very important nerve in our body that is actually regulating most of the unconscious or automatic function of our body. So When that vagus nerve doesn't work properly, we get into a lot of issues. Those issues can be digestion, can be heart issues, can be breathing issues, can be gallbladder issues, and so on. And so we have developed programs that are targeting mostly the vagus nerve so that it will allow the vagus nerve to not go either on overstimulation or understimulation, which is detrimental. To find basically the in between.
How?
And then program.
Yeah. How do you do that?
So basically, we implement in the program itself, in the music itself, little changes in the music that force two little muscles that we have in the ears to start working in a different way. By doing that, it actually released the vagus nerve. Vagus nerve is a little antenna that is ending up very close to the ear by the eardrum. And when the two little muscles of the ear start working better, then that vagus nerve is actually released of being almost inflamed, if you want, almost overstimulated all the time, and then can start really monitoring what it's supposed to monitor.
Wow. Because I know you helped one of my friend's sons, and that's how we met. And he'd obviously been through quite a lot of trauma, and she's seen some huge changes in him just through the music. And she's done so many therapies. Tell me a bit about some of the other children and what you see once you go through that, particularly within trauma, because I think trauma is one of those areas that the nervous system just holds on to.
Yes, absolutely. So what we have seen is that for a lot of children, and it can be for adults as well, but let's say for children, it's very visible, and we can really point to parents that most of the time that the problems that they have come actually from traumas that can have happened very early in life. When I say very early in life, it means, after birth, but also during birth or before birth, where, we don't usually pay attention of those moments, but actually during pregnancy, there can be events happening of different sorts. It can be events happening to the mother. It can be physical events happening to the baby, in the fetus inside. And this has an impact on the nervous system, very deep impact. And so when we have developed programs, again, that by using higher frequencies in that way, it allows basically to start healing those traumas and allow the nervous system to leave basically that situation of fly and freeze. Really that situation where there is no choice. Either you go away, or you fight what is happening, or you go in full freeze, but you don't have really a way to go in between. So I know I'm getting maybe a little bit more into details, but it's basically how we can help children. The issue is that those traumas are very deep, but when we start poking at those, it can bring a lot of reactions. And that's where it took us years to develop programs that are actually strong enough so that it really goes and start, moving those traumas, but still very soft enough so that it doesn't bring behavior difficulties that can impact school and other things.
Mm-hmm. No, it's incredible. And I know you have your own story about your own son, right? And why
yes,
you
that's
got into
correct.
this.
Yeah, so I've adopted two sons. They are now 24 and 25. But adoption is also another extreme trauma, although most people don't realize it and try to see the positive part. The child now is in a very loving family. It is so wonderful. But at the same time, to be in that loving family, the child had to lose everything he had before, meaning the 9 months he was in the womb with his biological mother was gone from one day to another. And he has to really, without knowing how, to mourn and to integrate all that loss. So I didn't know any of that when we adopted our children, but over the years, I came to encounter that approach that was developed by our French doctor, Alfred Tomatis, and I applied it to my children. And it's true that it definitely changed dramatically, actually, their life. For Laurent, the oldest, he had basically when he was at school, he was always telling me, I feel like there is a zombie behind me that is always talking all the time.
Yeah.
And when we did a listening test, we realized actually that he was hearing sounds that was normally, he should hear them on the right ear. He was hearing them as if it was coming from the left ear. So that was making that noise like the teacher teaching in front of him. Sometimes it felt like it come from behind. So it had dramatic effect, basically, in his attention at school and in the classroom.
Wow. I mean, that's amazing. And, that frequency we take for granted. So, how can it change the brain? Talk to me about that. Tell me about the music and the right ear and the left ear differences. And it's a great segue into that.
Yeah, so there are for our approach, there are two levels in the frequencies. So one approach is more the emotional or psychological one. And Alfred Tomatis has shown that the very high frequencies, what we call overtones, basically of the music, is what the fetus or the baby in the womb is hearing mostly. And he's basically hearing the voice of his mother all the time in the womb, and the way he perceives it is in the very high frequencies. So a part of our approach is actually to filter all the low frequencies from the music and only keep the very high frequencies, those overtones, and this allows the child to go back basically in the womb. So this is one part of the therapy. The other part is actually to force the ears and the brain to start paying attention to frequencies that he might have decided, for reasons we don't know, to not pay attention to anymore, or to pay too much attention to for different reasons. So we try to desensitize to some frequencies and to resensitize to other frequencies, so that the listening profile of the child becomes more standard and more suited for communication and living in the world.
Yes. Oh, it's just incredible. And, tell me a bit more about the vagus nerve and, how it plays into our whole body, because it's such an important critical nerve that goes through, majority of our body, right?
Absolutely. Yes, the vagus nerve is the longest nerve of our body. So it starts basically very close, as I said earlier, it starts very close to the eardrum. It has a little antenna there that is monitoring basically the way the eardrum is behaving. And so if the eardrum is actually behaving properly, so not too loose, so meaning that it would vibrate to any frequencies, neither too tight, that vagus nerve is actually working properly. However, in our world, where we don't have a lot of way for our brain to train our eardrums and our muscles, that vagus nerve get activated almost nonstop, meaning that a lot of people will we notice that a lot of people basically are very sensitive to the fridge noise, are very sensitive to flights, are very sensitive to anything that is actually low frequencies around.
Yeah.
And this is mostly related to the fact that the muscle that is stretching the eardrum is not working properly. So it will usually stay flaccid and the eardrum will start moving nonstop. When it does that, the vagus nerve is activated there and then cannot monitor as easily the rest of the body or get false messages if you want. So that means that you will have problem digesting because your gallbladder, the vagus nerve regulating the gallbladder, will not release the digestive enzymes and liquids at the right moment, but will do it erratically, basically, whenever it decides to do it. It can have an effect on the bladder, the real bladder as well, effect on the digestion, and then effect that are more indirect, but very important for children, effect on skin sensitivity. A lot of our children, when they have learning disabilities, they will dislike some type of sweaters.
Or
they will not want to.
Another one's plasters, right?
Yes.
Yeah.
So there is definitely something that is extremely there. When we start working with the therapy, depending on the type of sensitivity it is, but you will notice relatively quickly that those sensitivities start disappearing, which means that that vagus nerve is starting to cool down and allowing a proper monitoring.
Wow. Do you know, I think I should be putting myself on this program because I think I need it,
Yes.
to be honest with you. I'm going to talk to you about that. So,
Yeah, yes, I would like to say one more thing. In the past, we had way more ways to train our ears, for sound, so that those muscles would stay always properly activated, if you want. We would go to church, for instance, and church is usually made in a way that
yeah.
the resonance allow the frequencies to actually retrain your ears. We would go into the woods or into nature, we would hear water flowing or the leaves moving, and this forces those muscles to actually move so that you pay attention to those. We've lost all of that, and now we use mostly our phones basically as a source of programming.
Yeah, it's such a shame. It is such a shame. But I am going to talk to you about coming on your program. I mean, can you share a bit about some of the patient profiles and, some of the patients that you've helped and what you've seen in terms of their symptoms and at the beginning, and then what's actually happened after the therapy, so that parents can really understand that this is something that they should definitely try because it has impact?
Yes, I've worked with different type of children, and I will pick a few of the examples
Yeah.
I have. I think of a non-communicative child that came. He was 4 years old when the parents came to see me, and he was non-communicative. Although he was able to speak, he could say words, but he was not using them. Basically, only very, very occasionally. And so we went to the program together. And after probably a month, he started actually using his voice way more and starting to interact actually with the world around him. In this case, the other major change was also food. He was actually disliking pretty much all food. He didn't want to eat anything but mashed potatoes. I mean, I'm simplifying, but it was very limited. And he's starting to be willing to experiment with more texture, more taste, more things, and mimicking more what his family, because he had siblings, were eating as well. So this was, for the parents, it was such a relief, basically, in this case. For adults, usually people that come to us is usually when they have tried everything else. I mean, they've tried everything for digestion or for anxiety or for PTSD, and then they hear by chance, or I don't know, about what we do, and then they try it. And pretty much all of us, after a few weeks, start seeing changes. If it is digestion, as I was explaining, the gallbladder will start working again. After a few sessions, they start feeling that their digestive system is gurgling and making noise and doing things that they have never heard for a long time. And this shows that all those muscles are starting to work again. When it is anxiety, the major thing that they start observing is that suddenly people that are really that was getting on their nerves, certainly they are able to stay and have a conversation with them without feeling like they need to hit them or do things like that.
Yeah.
So yes, it has definitely big things. Then we have another part, and it's becoming more and more actually, people coming with sound sensitivities in general, that cannot really live properly because everything bothered them. Pretty much everything. And there as well, after a few sessions, they start observing that they start slowly to modulate a little bit and not having the heavy reactions they used to have towards sounds.
Wow, it's amazing. And so what does the program look like if people work with you? Do they have to wear earphones? Because lots of children won't put earphones on. So could you just put the music on in the room? Like, how does it work?
That's correct. So originally the program was made to be used with special headphones.
Yeah.
And so we have made the program evolve, and with a lot of testing and evaluation, we noticed that for most of the children, especially the most rambunctious one, headphones were not working. They could not really stand it. It wasn't bothering them. And then we experimented with speakers. So to quickly answer your question, yes, the best way to listen to the program is actually to use it in the background and allow the child to do whatever he likes to do, so that it's comfortable for him to do that. It could be, a lot of our patients actually do their homework while listening to the music. So that would be one way. I don't necessarily recommend it because homework can be already a challenging time. So if that child is already challenged by homework, I would not necessarily recommend to combine the two. But if homework is becoming it's a little bit easier, it's a good time to do that, especially during school days. But it could be drawing, it could be playing with magnetic tiles, it could be doing some Play-Doh. There are a lot of activities we can do together. Ideally, again, this is another thing I noticed, it's definitely better when the child is accompanied. So if, for instance, the mother or somebody else can be with him and allow him to go to something so that he can, let the music do its work, let's say, while they are actually relearning, because a lot of children as well have a lot of difficulties in social skills. And this is a very good place to start relearning about being with others.
So if parents are going to school in the car and they've got a 20-minute journey, could they still use it in the car?
Yes, most of the time I would say yes. However, I would have some limit. I would limit it if it is one of the programs we have that goes much deeper in traumas.
Yeah.
Those ones would definitely require a very specific, a more quiet and relaxed environment.
Yeah.
But if it is really for sound sensitivities or things like that, yes, the car would work, and actually it would allow them. A lot of parents notice very quickly when the child start listening to the music that actually he start really paying attention to the music, and he doesn't really hear anything else while the music is playing. Took a few hours, but then and they actually enjoy it. It's Mozart music, it's a very rounded music, very pleasant music, and in some ways it allows also the parents to have their children discover classical music. A lot of children do not know much about it. So
I love it. I love it so much. Tell me of something a bit deeper about using that Mozart music. Like, how did you get to the point of understanding this to the level that you do, and the frequencies to actually change behaviors? It's just incredible, and I know it works because my friend Maya, she says her son has just transformed. It's so different for all the therapies that she's tried. This one has just been outstanding for him, and he's non-verbal and has gone through a lot himself in his little life.
Yes, if you want, Mozart music is a little bit more like the carrier of the therapy. So that's what we use because it has it's very comforting. It doesn't it doesn't provoke deep emotions like other music might do. It doesn't have too much rhythm into it that would be impacting the child. And so that's why we chose Mozart music. However, the therapy is not in the music. It is the music, but it's more in the way we filter the music, or we make some switch in the music that force those two little muscles in the ear to start being retrained in a way that is more suitable to live in a world where we have loud sounds, thin sounds, and we have all the time to adapt to go to either paying attention to your voice as we do now while we talk, but at the same time paying attention to, I don't know, the coffee kettle, the kettle that is, doing its way in the kitchen or other things like that. And this is what the music is retraining. And that's why it's so long term, because when you start, when your nerves and your muscles in the ear and your brain has learned how to pay attention, not pay attention, this is for life. You never lose it afterwards.
Yeah. There must be so many children that you've worked with that have, been those children at school that can't be in big environments that's very noisy in an assembly, and so they wear those as headphones, or they are the ones that don't like going to firework displays because those big bangs are really quite traumatic for them in terms of the sound frequency and loudness that they're hearing it at. Because I do remember I did sound therapy with my own son, and he was one of those children. And when we went through that program and we did it, it was an app on my phone that I did it through, and he wore earphones before he went to bed, and it changed his whole system. It was amazing, and I really, really rate sound therapy. But the thing that it really did for him was he started hearing frequencies that he'd just never heard before. So the pitch of the teacher's voice, he could then start to take on those instructions. He could then understand how many instructions she's giving him rather than missing a few, and actually follow through. And that was massive, because his ability to also comprehend and process and then apply changed literally within 6 months. And it wasn't, too difficult to do the music therapy. So you must see this all the time.
Pretty much, yes. All that is conditioned, if you want. There's a progressive change happening, but it builds very quickly. Yeah. And a lot of the nervous system is made of pairs of nerves, if you want. And those pairs because it goes on the left of the body and on the right of the body, but it's the similar nerve on both sides. But the pair that is regulating one of the muscle in the ear is the same that is regulating the eye and also regulating the jaw. So as soon as you start regulating that muscle properly, it means that not only you start hearing, you start hearing the changes in sounds, meaning that you hear the instructions of the teacher more clearly so that you can make sense of it more clearly. But also it means that you are managing your jaw much more easily to produce the sounds that you now hear better. So not only you hear better, but you can reproduce them better because you are a better management of your jaw, your tongue. And so you are starting to have a very nice elocution, so, a nice speech, let's say, where before it might be mumbling words or, not really opening the mouth properly and so on. It might require some speech therapist contribution, so to help the child to really go over it. But the base is there, the way that it can use his body is definitely there after the therapy.
And so tell me a bit more about the trauma side with some of these children in terms of what you see when you start the music therapy, and you obviously take it very, very slowly. Tell me about that. And what are the kind of children you see, and how has it really helped them?
So the way it works for traumas is that the music, because going on the high frequencies, is reproducing very quickly that environment from the very early childhood and especially pregnancy. So that means that the body and the brain will start actually bringing a lot of dreams. So those children will start dreaming very vividly a lot during the process. And those dreams do not necessarily need to be interpreted. Although I can say that when you start paying attention, you realize that a lot of them are related to their life in the womb, meaning that it is always with something that looks like an umbilical cord or a placenta or something of that sort. And if you let the child draw, or play with Play-Doh, or play with sandboxes, that's a form of therapy that is more and more prevalent in South Africa and a little bit in the UK. I think you have it as well, where you have a sandbox and children can play with figures. They can have a dolphin or whatever it is, and you really see that they start, even child that are very non-communicative originally start really playing stories with those figures very quickly. And you can see that very not so slowly, sometimes very quickly, their behavior changes. Things that they were before totally impossible for them start being possible.
Wow. I'm fascinated by what you do. I think it's just amazing. I mean, you're definitely making an impact on so many little lives. And, I'm sure you work with many adults too. So how do people get in touch with you? How do you work with children and patients?
So I used to work only in real, if I would say,
Yeah.
really, people would come to my office and we would be listening to music together. And I would do this also in yoga studios, where people, mostly adults in that case, but would come and we would gather for an hour, 30 minutes basically, and listen to music together. The group has definitely also a very important impact, especially for adults. For children, it's not as important, but for adults, it can have an impact there. However, with COVID, I had to stop my activities. I couldn't do it in person anymore. And so it made me think of different ways to actually allow the people to get access to the therapy. So long story short, it allowed us to develop that online approach now that is available basically worldwide. That people can access online. So right now, the way to work would be to go to the website, to check a little bit what is there, and then get in touch with me at this point to still decide, which program might be the right program, because it can be overwhelming. There are quite a few programs now. I think we have 20 plus programs available. And so it can be a little bit overwhelming to go through the decision of which program to go. But when the decision is made, then it's just a question of accessing the program online, listen to a session. Each session is 60 minutes long. So you just make yourself comfortable, make your child comfortable, listening on the speaker for an hour, and then you go to the next sessions. And they are 8 modules for each programs. And so it's a progressive approach. You can, stop anytime you want, take a break if you need a break, or you can keep going. Some people, especially when they start seeing the changes, listen to quite a few sessions a day, if they can.
Yeah.
A lady with very heavy anxiety starting to listen to 3, 4, 5 sessions a day because she could see how it was impacting her very positively. So that's basically it. No more secret to that. If the child is very, how can I say that? A lot of children that come to me, a lot of parents, let's say, that come to me, usually they've tried everything. It's really their last resort, usually to come to a sound therapy because they don't really think that it might be there. So usually with those parents, I ask them to text me or to contact me at least once a week to make sure that the progress are going the way it is, and if I don't see any red flags. Because those children, again, are usually a bit more, not difficult, they are not, but the way to help them get out of where they are is a little bit more complex.
Yeah. And how did people get hold of you? They can go to your website.
Yes, the website is basically neurasonic.com. So neurasonic.com. And there's more information there. But this is the best way to reach me. And email address, through email or through WhatsApp. I work now with more, as with more people from Croatia, Serbia, Bosnia, and so on. I live in San Francisco. So it means that WhatsApp or other vehicles like that is actually the best way to keep in touch.
Amazing. I'm going to be recommending you to all of the people that I see. So this was
Thank you very much.
A brilliant podcast. You were amazing. And I am very grateful to you that you came on to share this, because I know it's going to help so many people who listen to the Brain Development Podcast. Thank you so much, Olivier.
Thank you very much, Laura. Thank you so much for having me on the podcast.
I'll put all of the things in the notes, and everyone can work out where to find you and how to get hold of you. Thanks.